Thank you all for joining us. We will be starting momentarily. Surely we'll have some poll questions up for folks as they join to just give us a sense of who is in our audience today. And as I said, we'll get started in a few minutes. Great, so those of you who have joined already, if you want to take the poll that should be up on your screen and let us know what industry you are from, that would be very helpful. We'll just give folks a few more seconds to select what industry they're in, just to give us a sense of who's with us today. And then we will close that and open another poll. Great, so it looks like we have a lot of folks from the financial services space, almost similar number of nonprofits, and then a number of other. Very curious who those others are, but looks like financial services and nonprofits are who we're speaking to today. Thank you. Right, and then for the second poll, we would just like to get a sense of the size of your organization. So as you're joining, if you can take a moment to let us know how many employees are a part of your organization, just again to give us a sense of who we're speaking to today and making sure that our content is as relevant as it can be to our audience. Great, so it looks like we got a pretty good mix, number of smaller organizations, some very large ones, and a little bit of everything in the middle. But certainly looks like a good number of folks on the smaller side. And as we know from this current crisis, the small organizations have in many ways been more affected than others. So thank you for sharing that with us, and gives us a really good sense of who we're speaking to today. So I think with that, we can get started. Again, thank you all very much for joining us. My name is Brian Gilmore, and I'm a director at Commonwealth and will be your moderator for today. In these unprecedented times, public, private, and social sector entities across the country are taking drastic measures to reduce the spread of COVID-19, which, as we know, is having a dramatic impact on the economy and therefore the financial security of many workers. We know this is a dynamic and ever-evolving situation that is affecting workers and industries very differently. This was clear to me personally last week when I was at the grocery store with aisles that were almost completely empty of produce. While I was there, I thought about the sheer number of hourly employees who were needed to manage that rush of demand, and those who would be there late into the night restocking those shelves for the next surge. And this stands in stark contrast to stories that we're seeing like American Airlines grounding 40% of their fleet and cutting coffee service to employees simply to save funds. So just a demonstration of the stark differences in how businesses are being impacted. There's an abundance of information related to this crisis, which can be difficult for employers to sift through as they seek to protect their businesses and support their workers, both through the immediate and long-term financial fallout of this pandemic. We intend this webinar to provide practical steps employers can take today to help alleviate some of the financial hardships caused by COVID-19 and discuss concrete strategies and interventions to help businesses and workers be better prepared for tomorrow. Of course, we recognize that we do not have all the answers, and frankly, no one does in this time of unprecedented economic upheaval. But we hope to surface some strategies and approaches that we and our partners have found to be effective and that may be relevant at this time. We also want to hear from you, our attendees, regarding what impact you are anticipating for your workers and industry, what steps you are considering or already taking, and what resources you need. We know this crisis is not affecting all industries and workers equally, and this is an important moment and opportunity for us to learn from each other. So as an agenda, we'll have a few poll questions to hear from you about what is top of mind. And then our panelists, who I will introduce momentarily, will speak about strategies and practical steps they'd recommend for employers to reduce the financial burden of COVID-19 on their workers and their businesses. We're going to reserve about 10 minutes at the end of the webinar to address questions from the audience. Of course, please submit your questions throughout the webinar as you have them. We will do our best to track them and address them during the Q&A session towards the end. For just a tip on how to address or to submit those questions, there's a question feature in the GoToWebinar panel that you have open. So use that panel to introduce your questions. I'll also note that this webinar will be recorded and we will be emailing you with a copy of the webinar within 3 to 5 business days. So again, you can see on the screen how to submit your questions through that question panel, and we'll be tracking those and doing our best to address them in that Q&A session. So now I'd like to introduce our 3 speakers who will share their perspective on what employers can do to address both the financial challenges brought on by the current pandemic, as well as the pre-existing financial challenges that households were facing prior to COVID-19, which have been exacerbated by this economic slowdown. Got 2 of them, there we are. Great to see your faces, everyone, and thank you so much for joining this webinar and sharing your perspective today. So as for introductions, we have Marielle Beasley, principal at the Center for Advanced Hindsight at Duke University and co-director of the Common Sense Lab, a sub-center committed to improving the financial security behavior of low to moderate income households in the United States. We also have Timothy Flacca, who is executive director and co-founder of Commonwealth, a mission-driven organization that builds solutions to make people financially secure. And finally, John Thompson, who as Chief Program Officer at the Financial Health Network, is responsible for leading all of the network's programmatic activity, including its research, consulting, innovation network, and policy practices, all of which are designed to foster promising innovations that advance consumer financial health. Common Sense Lab, Commonwealth, and the Financial Health Network are all partners of the BlackRock Emergency Savings Initiative, which has been working with partners across sectors to address the country's emergency savings crisis, including UPS, MasterCard, Etsy, Brightside, Arizona State University, Acorns, and Uber. And while we recognize that helping households build an emergency savings buffer remains critical work, we also know that businesses, workers, and households have been affected in different ways by COVID-19, and that a comprehensive, multifaceted, and cross-sector approach is necessary to address the financial security challenges that have been brought to stark relief by this current economic crisis. In an important way, we're trying to address 2 emergencies here: the acute crisis as a result of COVID-19's impact on the economy, and the financial insecurity faced by millions of workers that predates COVID-19 and has been exacerbated by this pandemic. Our challenge is to try to address both the acute and underlying issues such that affected workers can better weather the current crisis and be prepared for future ones. So before we get to speaker questions, I'd like to turn to a few additional polls just to understand what issues are top of mind for you, our attendees. So for our first question, we'd like to know, what steps are you taking or considering to support your workers at this time? And please select all that apply. Okay, just a few more seconds to complete that poll. Great, so it looks like the top action that folks are able to take is new or expanded sick time, paid time off or health benefits. Some folks are thinking about one-time bonus payments or new and expanded hardship grant programs. But pressing and critically important, it looks like a lot of folks are feeling like they are not in a position to take any action now. We hope through this conversation, you all may be able to identify actions that you can take that just may not be top of mind. Great, so for our second question, as you develop plans for the pandemic, we're eager to hear from you. What length of economic slowdown are you preparing for? Great, just a few more seconds. Okay, so again, a range of answers. Looks like most folks are thinking about 3 to 6 months, a handful more 6 to 12 months, a few preparing for the worst. I will say there was a recent JD Power survey with consumers that also are looking and expecting for 3 to 6 months of economic downturn. So it seems to be some parallels with that as well. So one final question. So what HR actions do you anticipate in your industry? So really this is about, do you expect hiring, cutting back, layoffs, maybe switching to more contract or part-time workers or other? If you have an other response, feel free to enter that in the chat box and we will track that as well. All right, so it looks like, and again, I think this speaks to the diversity of experiences in different industries. So almost 20% are expecting hiring, some thinking about cutting back hours, pretty significant number expecting layoffs, some switching to more contract or part-time workers is a little bit lower. But I think this demonstrates the, one, the significance of the impact on workers such that most are looking at cutting back, layoffs, or switching to part-time, but there is a segment that is still focused on hiring and growth. And so we hope to address that diversity of experiences in our comments today. So thank you again, really appreciate your participation and helping us to understand what to frame our comments around and what you all are expecting as attendees. We want to make this as valuable to you all as possible. So now I'd like to shift to questions for our panelists. And Tim, I want to start with you. In your open letter last week, you called out the unprecedented economic impact of COVID-19 has laid bare the widespread financial insecurity that many Americans face. What do we know about the financial well-being of workers before COVID-19, and how might businesses and HR leaders think about how to respond now that it is adding more financial stress to these workers and businesses? Oh, can't hear you.
Hi, everybody. Can you hear me now? Great.
Sure can.
Super. Well, first of all, Brian, thank you so much for the introduction. And I think I speak for all the speakers when I say thank you all for coming to listen to this today. I think we know leaders and HR leaders are under incredible strain right now, so we appreciate your time. And to the question, Brian, it is important to remember that for many, many, many Americans, we come into this crisis with a widespread financial insecurity. And I think many of us have seen the numbers. A couple that come to mind: estimates between 50 and 78% of Americans say that they're living paycheck to paycheck. And I think probably almost everyone is aware now of the Federal Reserve's research that about 40% of us have $400, do not have $400 in savings. I think it's helpful to remember last year, the government shutdown, which now seems long ago, was in some way a foreshadowing of what we're going through now, when nearly 800,000 pretty well-paid federal workers, many of them really struggled to miss a paycheck or two. Of course, that's not true for every single worker, and I think something we'll hear in the conversation today is that there are a lot of different experiences out there. But at a baseline, this should really inform our thinking about this crisis. You know, we're starting with a lot of people who are already at risk. As it happens in our work at Commonwealth, we do a lot of talking directly to consumers and original consumer research. And just in the last week or 10 days, we've been out in the field, so to speak, talking to people. And so we have very, very preliminarily begun to see some different sort of ways that people are experiencing this crisis. So I wanted to share those briefly. And the first of those is folks who have already experienced some very direct fallout from COVID. So these are the people who've lost a job, who've gotten laid off, or who had hours reduced, or whose opportunity to work in the gig economy has been curtailed, can't get to work because of shelter in place, or have a partner or a spouse or a household member who has. In some cases, we've heard people say to us that they really are having to choose between making health choices and financial choices. If they go to their work, they feel like they are taking a health risk. The second segment, that we're hearing from are folks who it hasn't really hit for them directly yet, but they're very concerned. And these are people who can see the handwriting on the wall. They see what's happening to their employers. The revenue may be drying up, or they work in really volatile industries to begin with, or they know that they're prone to recession. Here too, household issues matter. This can be a case of worrying about that because another earner in your household is experiencing more direct hits. And the second piece is that people's expectations are shifting dramatically. What it means to be financially secure may no longer be about aspirations in this moment. It may be about just being able to put food on the table. And then there's a third group, and these are folks who are still stable. They don't report lost income. They're not particularly pessimistic about the impact for them. They focus on the changes in the social conditions of social distancing and not going out of the house and maybe working from home. But interestingly, even this group says, but I've sure spent a lot more money on groceries since this happened. One person told us they've had to start paying for different internet because they have a student who's home. So it is impacting even that third group. So to the second half of Brian's question, how might we respond? Just a few thoughts on that. As employers, I think the first question is, what can I do today if I can do anything? And that speaks to providing one-time bonuses we've seen somewhere, perhaps extending sick pay, in some cases emergency grants and so forth that we'll talk about today. One step after that is sort of the medium term, and here the key thing to think about is how can you amplify or complement the public safety net? And we've seen a lot on this, everything from student loan forbearance to more traditional safety nets. How can you make sure your workers understand how to apply for SNAP or food stamps, for unemployment insurance, or for the new congressionally mandated sick pay for COVID? And then, working further along, it's what's the longer term? And here the key thing to think about is, for many of your people, this is not a sprint, it's going to be a marathon, and you need to do what you can to help them prepare for the longer haul. So here we think about building savings, capturing windfalls as a way to do that, and thinking about what sort of resources you can help for people, for example, who are working from home. And then finally, and this one is really important, is as much as we can, we want to start thinking about that recovery. And there the lens is never again, right? What can we do to make sure that we come into the next crisis, whatever it might be, more secure and more able to manage? So we want to think about savings there too, but also expanded, perhaps health insurance, disability insurance.
Thanks, Tim, and really helpful to hear that very personal and close perspective from the consumer research that's been happening over the past few weeks. I think related to that, but on a different vein, John, the Financial Health Network has collected a significant amount of data on household well-being at the national level and really provide a national picture through the Financial Health Pulse survey. curious how you think about those findings now in the context of an event like this.
I appreciate the opportunity to talk about it, Brian. And I think, Tim, both some of your comments and some of what we saw from the responses to the early questions in the webinar also point to a lot of uncertainty about kind of what's going to happen, when it's going to happen, how it's going to happen. Obviously, we're looking at a historically large federal response, but the timing and actual effect of that on businesses of all different types, the employees that work there, and just people in the country is, I think, in many ways still something to be discovered. And we're in some ways, I think, as a sector and as a country, trying to figure out the ways when we can be confident about how we're going to respond. In our work at the Financial Health Network, we define financial health as something that comes about when your daily systems are functioning well, and your ability to be resilient is strong. It allows you to pursue opportunities. So those three interconnected components of financial health are all equally important. Obviously, we're seeing a pretty strong test of perhaps a unique moment to demonstrate resiliency. And we're going to see a lot about how this lands differently on people in this country to the segments that Tim had talked about. In our work in 2019, we had found by our measures of financial health, only about 29% of the country was healthy. So roughly 71% of the country was having difficulty across one or more indicators of financial health across spending, saving, borrowing, and planning. And we've been looking at this over several years now. And some interesting trends that we saw between 2018 and 2019 moving into this crisis feel particularly relevant right now. As we started 2020, we had seen consumers feeling more confident about their ability to pay bills on time and in full. We had seen consumers more confident about their ability to manage their debt. And we had seen consumers less confident about the applicability and comfort that they find from the insurance solutions that they had in front of them. And also within this data, we had seen that more than half of the respondents had experienced some material amount of change in their financial health, principally driven by two things. One, either a change in employment status or a change in their physical health, they or someone in their household. The presence of all of those, of course, feel incredibly important at the moment and very, very prescient. Two things that we also saw in our analysis of financial health in the country is that when these experiences drove positive or negative changes in financial health, the presence of savings in particular was something that allowed to blunt a negative effect or really take advantage of a positive life event. And the flip side of that, of course, is the presence of debt had a really strong impact as well. When we dug, and I'll finish here because I want to talk later a little bit about some of the responses that we've been getting from our membership network about the things that they in particular are taking as employers. But when we dig into our data and look for how respondents are talking about their employment status as it relates to their financial health, four things come to the top of the list. First, that for them personally, they're able to pretty confidently connect the financial stress that they feel with the productivity that they have at work. Secondly, that they are explicitly looking to their employer for solutions against their financial health challenges. Third, that the needs that they have are more diverse than employers typically currently offer. So while we may be experiencing healthcare interactions or health insurance interactions or retirement interactions with our employer, the needs are much broader than that. And lastly, that there's a feeling of some deficiency from the employer standpoint about what they're getting, or from the employee standpoint about what they're receiving from their employer. So those are some of the things that the data from the U.S. Financial Health Pulse show.
Thanks, John. And I know that Commonwealth has found in our own research that employees are looking to their employers for advice and guidance. So an important reminder to call out that many employees trust their employer to provide that advice and guidance. You also mentioned the government assistance. So Marielle, I want to turn to you and ask, with the federal government hopefully close to finalizing an assistance package that will very likely include direct financial assistance provided to households, what insights from behavioral science or examples from Common Sense Labs work might offer strategies that employers could consider to help their employees manage that kind of a windfall?
Sure. Thanks for having me. And as mentioned, it seems like we might be actually close to having this the assistance package passed, and so this is looking like it's going to be a real reality for a lot of folks to be receiving this. And so in behavioral science, some of the things that we know are, one, people are actually not particularly great at handling windfalls. And as painful as this is, I think we can all kind of reflect on times where we've anticipated using a packet of money that we're getting in a really optimal way that's going to be important to do X, Y, or Z. But when we have all these other demands on our time, attention, particularly if we've got kids that are home all the time, it's very easy for us to actually kind of spend through that windfall very, very quickly, rather than sort of planning for the long haul with that. And essentially what that means is that, and this is largely what we see, is that when you have a windfall, in some cases, people actually will overspend that windfall, basically meaning that they'll sort of, allow themselves a little treat, which, when times are stressful and people are dealing with all of this, people need to have some sort of a relief and treat, but they might actually kind of overdo that and then not be able to stretch that out for bills that might be coming sort of later down the pipeline. And so the research really shows that how do you help people kind of deal with that and better plan for that? One is to help them sort of think about their plan for that windfall. And so I think there's a couple of really unique opportunities as an employer, is that, as the employer, you have kind of a unique understanding of who among your employees might actually be qualifying to receive some cash assistance directly from the government as part of the federal assistance package. And so you can actually proactively reach out to folks in sort of personalized ways, let them know, sort of get them to think about just, FYI, you might be qualified for this. Make sure that you sort of understand how you might be receiving this, because people will be receiving it in different ways. Get them to sort of, and just ask them to take a little bit of time for themselves and their family to think about how they'll use that stimulus for their family. And by really encouraging that planning prompt, there's just all kinds of research from across disciplines that show that will actually help people sort of better align their actions with their intentions. So really getting them to actually spend it in the way that when you ask somebody rationally, how would you spend this money, actually gets them to follow that. So I think that's an important place, is, you can reach out directly to employees that seem like they might qualify and sort of personalize sort of that email reach out to get them to think about, plan, understand how they'll receive it, when they'll receive it, if they need to do anything to receive it. That's really important as well as a important sort of communication out to your employees. And then again, that just asking them to think about how they'll use it. I think another important piece to the cash assistance package is that it might also be some things that might impact this government assistance package is that it might provide some leniency on allowing employees to access retirement funds, which is sort of large amounts of cash that they maybe have been putting away, and now all of a sudden they might not have, they might be able to access it without fees as part of this. And while that will likely be helpful for a lot of families, I think it's important to remember as the employer, and to be able to communicate to folks that might have this option. What you'll really want to do is actually encourage them to take small amounts out of that if they're going to take amounts out, and potentially do smaller amounts, even if it means that they need to come back again, a month later to pull out a little bit more, or some more time a little bit later to pull out more, and encourage that small amounts. Because when we have larger amounts, it's just harder for us to think about opportunity costs. And those opportunity costs are, essentially, what are the trade-offs of if we spend money on this, what does it mean that we won't spend money on next time? And so it's just really, really important when we have access to large sums of money, like a retirement account that we've maybe been really good about putting money in, that it becomes very easy to kind of overspend on that unless we're taking out those small amounts. And also, I would just while it's an exciting, it's a nice thing for some folks to be able to access that cash. I would really, as the employer, try to encourage employees to do that as a last resort and really encourage them to look at other resources that are available. Just because, particularly since much of the retirement savings is in the market, when the market's down, that's actually a very expensive option to be pulling out of that cash. So I would really recommend that you really kind of encourage them to take up other resources before going towards taking access to that pool of cash.
Thank you very much for that. And I think that builds off of John's comment that employers can be a resource for their employees, even if that resource is primarily informational and helping provide advice and guidance for other resources they can tackle. And you also touched a bit on the importance of trying to preserve retirement savings. And given, as I mentioned earlier, that all three organizations are part of BlackRock's Emergency Savings Initiative, I do want to ask how you think about savings in this current moment. So maybe just a minute from each of you on that topic, and Tim can start with you.
Yeah, great. Thanks, Brian. Well, just to repeat something that's been said that I think is really important is that this crisis is going to hit different families at different times, and probably for your workers, depending obviously on your industry and your community, you may have a whole lot more who are facing peril down the line than are facing peril today. And so it's really important to think about savings as part of what we can do to prepare ourselves and what you can do to encourage your workers to prepare for what may lie ahead. And concretely, that ranges from the important but lighter lift of messaging and reminding and sort of encouraging to the very concrete tools that employers have of split direct deposit, right, to encourage workers to take a structural step for some of their funds to go into savings directly from their pay, to recognizing that, again, depending on your workforce, a significant number of your workers may just not have a good place to store liquid savings, and you can play a really important role in bringing in a credit union or a bank or a fintech to address that gap. Because it's a truism, if you don't have a place to save, you won't save. The other thing, just on the topic of savings, I think the poll, if I remember from the top of the webinar, about 1/5 of us on the call are thinking there might be some role for some form of cash or emergency assistance for our workers. I'm not sure I remember that right, but I would encourage you to think about the pros and cons of offering that as a seed deposit or a match to savings. That's a way that you can provide a very clear incentive for workers to think about and take action on savings. And to go a step further, for those of you who have health savings accounts in place for your workers, I just want to do a quick advertisement for thinking about making a seed deposit or a one-time contribution to those health savings accounts. This is an existing structure that's very easy for you to put a little additional funds in. It's a way of providing emergency assistance, if you will, but in a structure, in a setting where there's some shock absorbers between taking it out. The funds are pretty flexible, but they're also targeted to health, which is, of course, on point in the pandemic. They're tax advantaged for you as the employer and for the worker. And in the event that some of your workers don't experience real hardship, which we don't know, but if that were to be the case, then those funds have been put in a structure that enables and rewards long-term savings. So just a very specific idea for those of you who are in that position.
Great, thanks, Tim. John, Marielle, what do you want to add to that?
Maybe two things I'd add to that, Tim. I think our data would suggest that the savings as a behavior, even if it's in small amounts, can be really helpful even during times of crisis. And so I think that while it may feel in this particular period to talk about savings is a little tone deaf when there are wide swaths of people around the country who frankly need access to liquidity immediately. I do think the data would suggest that it's going to be really important, especially in the way that you talk about different segments of people experiencing this crisis in different ways and at different times, to not just give up on that. I think in many ways, now's the time to lay a foundation for the future. I also think from from an employer standpoint, for employers who can, and I mean those that have the scale, size, resources, and competence to be able to lean in and invest and help people navigate this crisis effectively, we need to do it. The people who are least able to fend for themselves are the employees and their families. The resources of this country, federal, state, private sector, so on and so forth, need to step up in this moment and help make sure that people can navigate it successfully and be in a position to rebuild. And so I think it's a time to be bold. It's a time to not, in some cases, overthink it or be too precise or too perfect, and focus on the people that you need to take care of.
Yeah, and I would add that I think one of the things that is really emphasized right now is the fact that savings is not just an accumulation exercise. And by that, I mean is that savings isn't just about putting money in, watching it grow. That savings is about essentially just not spending something today to be able to spend it on something tomorrow or next week or next month. And I think that this really emphasizes the fact that, like, it's not about should people save now? The answer is obviously yes, right? Because you should constantly be thinking about how are we helping our employees be planning, like, just until their next bill, or planning until their next rent payment, or planning until the month after that. And I think that this really emphasizes the fact of, and the way that we ought to be thinking about savings within this is this really close relationship with cash flow management. And savings really is just about how do we help people manage the cash flow that they have, and as they have it, in order to sort of optimize for being able to participate in in the things that they need to receive and get, and services they need to receive in the future. And I think that what this emphasizes is that future might be even nearer than people thought. And so I think it's all the more important that we're really thinking about savings as this liquid vehicle. It's not necessarily a put it away, forget it, never see it again. It's that this might be cases where you're helping people put money away and almost hide it from themselves just until the next week or until the next month. And John sort of alluded to some of this as well as some of their research, but more and more research is also showing that having just basically any additional dollar in savings is really helpful in being able to sort of put food on the table, essentially get bills paid. That it's not that this all or nothing type of savings piece. It's not that you have to have enough saved for an emergency, otherwise it's not worthwhile. It's that basically every additional dollar in savings helps. And so it really is all the more important to help people think about savings, even if it's micro, even if it's short, very, very short term. And then the second point that I would add, Tim talked about, there's a lot of great products that are already out there. People already are, in many cases, they're able to split their direct deposit into multiple accounts. There's HSAs, wonderful products. And I think when we think about from a behavioral science perspective, it's all the more important to not just think about the product, which is obviously a core important piece to it, but also, how do you make sure that the process of getting into that product and using that product is as easy and motivating as possible? Can you reduce the friction for somebody to actually to actually start contributing to their HSA? Can you actually reduce the amount of friction that it requires for somebody to split their direct deposit? Can you sort of carve out time on their calendar to let them to go ahead and set that up just to make it easier? Can you provide, rules of thumb or small suggestions on how folks might be able to use these tools, and then have direct links on how they can then actually carry forward with that intention? And just thinking not just about do we have the product, but do we actually also have the whole process around that product to help people get into it and use it in a way that's optimal for them in this moment.
That's great. Makes it very sort of practical and actionable, which I feel like in this moment, people want to have ways to take action. So appreciate that. Do want to shift gears a bit. We did ask folks to submit questions as they registered, and Jessica, Main Street Launch in Oakland, asked about, are there any tailored resources specifically for Black and Latino business owners and employees? It seemed like an important issue to raise. Tim, I think I'll pass that to you as well.
Yeah, thanks, Brian. And I just want to start by saying I'm really glad this question was asked, because I think it is very, very likely that that is an audience that will not always be reached by other efforts. And so I think it's very important. I just want to pass on what I've recently read, in this case, in Aspen Institute blog, and that for Black and Latino-owned businesses, in many cases, traditional lenders, and I think what we're talking about here is the overlap between Black and Latino and very small businesses often. Traditional lenders will not know how to make loans. And so what that calls into or brings to the fore is the importance of the lenders who do know how. And we're talking about community development financial institutions, community development credit unions, who can deal with loans that are in some cases smaller in size or that require different kinds of or more creative underwriting. That community is already focused on this issue and this mission, and I would strongly encourage you to, to sort of pass the word about that. The one other point that bears repeating is that this is really important because at the very small business level, where there are not access to good credit, people are at risk of, for example, putting items on their own personal credit card with very, very high consequences if that does not work out. So we really want to do all we can to make people aware of these, somewhat less high profile perhaps, but more tailored lending solutions.
I think the thing I would add to that, Tim, we're just starting to get a peek at what the federal response may be, unfortunately. And then I think, obviously in a disappointing way, the mobilization of the country around the short and long-term impacts of this particular crisis is still in its beginnings. I'm hoping that the federal movement can actually start to give opportunities to the private sector, to the philanthropic sector to respond. There's been some, one of the things that I'm starting to see is, to your point, is the organizations that do have connectivity to small business owners, typically community-based or regional, and are starting to put a call out for the capital that they're going to need. And this is an opportunity I think that people are going to really have to think about targeting the spending that and support that they may have in mind in order to make sure it makes its way to the people who need it the most.
Great, thanks, John. And I just want to acknowledge, we really appreciate the questions that are coming in from the attendees. In the interest of time, we may not be able to answer all of them, but just wanted to say we appreciate that, and to the best of our ability, we will try to get at those. So I think in the, speaking of interest of time, do have a couple more questions for the panelists. May ask you all to try to keep your answers brief and just hit on the key topics. I think the topic of emergency cash assistance has come up a number of times, and Commonwealth has done research around that solution. So it seems like a timely point. Just want to give you a moment, Tim, to speak to sort of best practices or what we learned around that emergency cash assistance as a tool.
Thanks, Brian. It does seem like a topic of the moment. Just a few points on this. First of all, we recently published a report called Illuminating the Hidden Safety Net that's available on our website, or also on the Aspen Financial Security Program website. So that's a resource I would steer you to. The second thing to say is that many people are not aware that corporate America is in this business of providing hardship funds. I frankly was surprised to realize how widespread the practice is. JetBlue, Home Depot, Walmart, Levi's, the sort of list of blue chip companies, and many smaller businesses who have programs for disaster and other forms of hardship assistance is remarkable. So if you are having conversations internally about what sorts of tools you should consider, it might be helpful to realize that this is not a loopy or boutique idea. What we've found in our research is that these programs are incredibly high ROI. In other words, workers in crisis are incredibly appreciative when their employer plays a role in addressing that hardship. Honestly, even sometimes more disproportionate to the amount of relief that they receive. So that's something to consider from an HR perspective. Best practices are, it needs to be quick, it needs to be rapid, it needs to be respectful and fair in terms of the process. More is in the report I referenced. I would consider going very light on the required documentation. It is important to be fair, but speed matters, and there's a lot of upside to assume that a little bit of non-compliance with your policy is an acceptable trade-off for speed and signaling trust in your workers. Strongly consider a model where workers are able to make contributions. Probably you have people in your organization who are right now looking for where is the best place to make a donation, and will leap at the opportunity to do that in a way for their peers in their community, especially, frankly, your higher paid folks. That takes some of the costs down for you as an organization, and it really does foster a sense of community. People really like to be able to support their coworkers, to know that they did that, and on the receiving end, to know that somebody else in their organization was there for that. If you need help in setting these up, there are organizations who can do that. Many of us know the founders of a fabulous startup called Canary. There's something called the Emergency Assistance Foundation, EAF. There's a wonderful fintech out of San Francisco called Saver Life that has capabilities in this place, and the list goes on. So don't feel like you have to do it on your own.
Great, that's very helpful. A lot of great resources there for folks to follow up on, and definitely to check out that report. Want to shift again to acknowledge some of the responses to the initial poll of folks expecting to have to resort to layoffs or cutbacks. So Marielle, for employers who really cannot survive the impact of this event without making that very difficult choice of laying folks off, what are some things you could recommend that they do in terms of maybe connecting folks to government resources or other social support services when they have to make that tough decision?
Yeah, I think obviously it's not a decision any employer wants to have to make, but when that is really the only option available, it's really important to make sure that it's not just about providing information about what resources are available, but actually helping provide the supports necessary to actually help employees like start and understand the process of applying for some of those benefits. It's actually an incredibly complicated process to apply for a lot of the benefits that are available, whether it's unemployment, whether it's SNAP, whether it's like any type of electronic benefits transfers. It's an incredibly complicated process, and in such that actually many people who are eligible never actually end up completing the process. And I know it sometimes is hard to fathom that something so important, basically people don't complete it, but there's lots of evidence to suggest that, I think it's about an example just is that about 4 million people who qualify for Medicaid don't have it. They haven't applied. They haven't completed the process because it is cumbersome, and it's going to be the same thing for your employees. And particularly something that's important to remember is that when people are operating under a sense of scarcity, which your employees are going to be operating under, that is essentially equivalent. The impact on our sort of cognitive functioning is equivalent to about going an entire night without sleep. Which means, think about like if somebody's trying to give you really complex information and asking you to do a whole bunch of complex steps, as if after you have gone an entire night without sleeping, it's very difficult to remember the things that have been told, understand what the next steps are supposed to be. And so really making sure that you're making that process easy, smooth for people, and really kind of helping hold hands and provide reminders along the way, checking in with folks is going to be really important as you help sort of not just giving that information, but again, really walking through the process with folks to helping them get their documents together they might need to. It will be an important process to help make sure that your former employees are able to get the supports that they are qualified for, and that will help them survive.
In my former life, I was a part of an organization doing just that, and can't emphasize that point enough, and that there are great organizations out there who provide that support. So, look out for those as well if you are, trying to support your employees through that tough process. Last question for John, and I think you hinted at this earlier, that you are hearing from your network members of what actions they are prioritizing and maybe putting in the parking lot for after the immediate challenges are addressed. We raised a lot of potential actions today, so would love to hear what you are hearing from those members about sort of what's top of mind and what might be coming sort of after the fact when things hopefully settle down.
Yeah, thanks for that opportunity. We as part of our programmatic work, we lead a network of about 160 members around the country, organizations of all different types, banks, credit unions, processors, hospitals, employers, who have come together around the concept of financial health. And over the last week, we've been talking to them directly about the actions they're considering, the actions that they're taking, the ones that they're scared about, and why. Actually, this morning, a couple hours before we started the webinar, we actually launched a page off of our site, which catalogs the activities that our members are taking, those being categorized either by actions focused on their customers or on their employees or on their communities. And some organizations are focused on all three or have the resources to focus on all three, some just on one. So that list is growing by the 15-minute increments, but please do take a peek there. It's a much more substantive list than we can really dig into on a conversation like this, but we intend to kind of keep that focused on the actions that companies are taking in those categories. A couple of themes that have come out from the conversations that we're having that I think would be interesting to share. One of the challenges that especially larger companies are facing is about the right types of communication from the right levels in the organization. What's the role of the CEO? What's the role of the human resources function? How can you split, if appropriate, the communication of detailed, specific, policy-oriented information in enough detail that it can be acted on, and not miss the opportunity to actually help employees with their own confidence, connectedness to each other in the organization, as well as just their spirit. We all need that kind of support from the people that we spend so much time with at work. I think really, Tim mentioned it in some ways in his prior comments. We see some loosening of the strict procedures that exist around some HR policies in a way that tilts the balance more towards the employee and the trust in that employee to make sure that they have what they need versus trying to protect some rules-based structure. And that's a real step forward that organizations are starting to take, especially when we're putting HR systems and policies under pressure that they may have not felt before at this, in this pace and this scale. And I think the last thing that I would take from these conversations is the access that human resources leaders have now to the most senior levels at the organization that they work for, and the interest that senior leaders have in what's going on in their employees' lives is, as reported to us, something not seen in some time. And so we need to take advantage of that opportunity, both in the short term, but to the root of your question, Brian, in the medium and long term, to make sure that we don't simply move on to KPIs that don't include the well-being of our employees.
Great. I appreciate that, and I know that was a question that came up in the registration as well, of how you balance, business needs and employee needs, and making sure that they're aligned seems absolutely critical, and has just been heightened by the current crisis. There's so much to cover that I'm realizing we have a very short amount of time for audience questions. I do want to throw one out there, in part because the conversation around savings and matched savings has come up. So just a question from the audience around recommendations about how to implement a matched savings program in terms of what kind of behaviors you should incentivize and how to do that well. Just curious if any of the panelists wants to say a minute or two on best practices for designing matched savings.
So we haven't coordinated on this question, so I don't know if we have different sort of feelings about best practices.
You got it.
So from a behavioral science perspective, we would say you want to reward the behavior rather than the outcome, meaning that you want to basically reward the deposit. And it makes it a little bit kind of confusing sometimes when it gets like really complicated match scenarios, but really sort of encouraging people to kind of put money aside, and having it, and basically sort of emphasizing that you reward that behavior of putting money aside. And what we would also recommend is that it not be like a 1-for-1 match. And I know that this is maybe a little bit unusual, but what you don't want to do is only reward the people who are most able to save at this moment. And if you have a complete 1-to-1 match, then sometimes what happens is that you're just giving more savings to people who are able to save. And instead think about saying that what we'll do is either we'll put money into, we'll put a set amount regardless of however much you put into that account, as a way to just, so if you can only save, $25, you'll get sort of the same additional match or contribution from your employer as somebody who's able to put $100 in or $200 in. So that's a little bit of a way to adjust some of the equity in it.
I'll just jump in and say quickly, underscore Marielle's point, like helping people to take action and get started and focusing on the behavior and not the size. One of the benefits of that is, in our experience, people feel tremendous pride and satisfaction when they do this thing that they just intuitively sense is prudent and in their self-interest. And so I wouldn't underestimate the impact you can have by helping people to take that step. And that's the frame. We've been doing this for almost 20 years, and I really have yet to meet a person who needs to be persuaded that saving is a smart thing to do. The issue is how do you help people get where they already want to go? And I would just keep that in mind as you design a program. There's no finger wagging necessary, right? It's just, what can I do to help you do this thing that I just assumed you want to do? And the last thing, we would make a plug here for prizes as a way to incentivize saving as being a very cost-efficient way that also hits some of the equity issues that Marielle is describing. Happy to field more specific questions on that, but there's a lot of research that shows that's a good way to structure what incentive dollars you have.
John, I don't know if you want the last word before I close us out.
I think you've got two of the experts here, so I'll let you take it to closure.
Great, appreciate that. There's so much more that we could talk about, but I know that everyone is incredibly busy in this moment, so I want to respect the time and just say a few closing words before we hit the top of the hour, which is really just to thank everyone for joining this important conversation today. I want to thank our speakers and partners in the BlackRock Emergency Savings Initiative, Marielle from Common Sense Lab, John Thompson from Financial Health Network, and Tim Flocka from Commonwealth. We really hope this conversation has provided some practical approaches to help us all collectively respond to the immediate challenges presented by COVID-19, while also raising up those strategies that can ideally help our most vulnerable workers be prepared for future economic disruptions. So in these challenging times, I find it really inspiring to see the world rally together to try to affect systemic change while also addressing those immediate needs. Hopefully through events like today's webinar, we can continue to listen to, learn from, and share with one another to try to make a lasting impact on our businesses and communities. We also recognize that there are other important conversations happening on this topic and other resources available. John mentioned the page that was just launched by Financial Health Network. Commonwealth will be continuing conversations around the impact of COVID-19 across various industries with a series of upcoming webinars in April, so stay tuned for that. As I mentioned at the beginning, that we will be sending out a recording of this webinar by email and with information about other webinars and discussions. If there are additional resources that we can include in that to support you all in your ongoing work, we will do that as well. And finally, thanks again. We hope that everyone and their families stay safe and healthy and try to get out and get some fresh air in these very difficult times. So with that, we will close it and we'll talk to you again soon. Thanks all.